Welcome to Thursday's edition of COVID-19. The daily tally has marked a slight decline but remains close to the 2000 level. Adding on to this concern are findings that recent breakthrough infections at a local nursing home were caused by the Delta variant. Now, we have more on this later on the program. Here first is Kwon Soa with the broader pandemic coverage. Soa.
Yes, Sunny, we have dropped down to below the frightening 2,000 mark, but nevertheless, 1,987 cases we're seeing this Thursday, which is still the second highest ever caseload that Korea has reported. Now, both domestic and imported cases have dropped this Thursday, and the average number of cases in the past week stands at above 1,700. As you can see here, a slight decline. Meanwhile, we've got a revision from yesterday's figure by one case. Now, this Tuesday, the proportion of cases in non-capital regions has risen to 38.3% with 746 domestic cases, which is the highest figure for non-capital regions during the fourth wave of the virus here in Korea. So for a closer look at our map, we've got a decrease in the capital's Seoul and Gyeonggi province to the 500s. A similar figure in Incheon to yesterday, but the city now has surpassed the 10,000 mark in total infections, and we've got a rise in cases in Gangwon-do province as well as down here in Busan. Now, the total number of infections has risen to 218,192, and if we go over to our vaccination updates, so we've got 8.2 million people, or 16% of the nation's population, who has been fully vaccinated, and this figure is expected to grow beginning this Thursday as citizens who received their first dose of AstraZeneca vaccine back in May and June will now be receiving their second dose. That includes seniors aged 60 to 74, as well as people working at high-risk venues, flight attendants, and essential workers. Those aged 50 and above will be given AstraZeneca for their second dose, but those aged under 50 are now subject to cross-inoculation, meaning they will get Pfizer for their second shot.
Right. Now, aside from vaccines, so I understand you have some updates on the treatment front.
Right, Sunny. So first, on the domestic front, Korean pharmaceutical giant Celltrion's COVID-19 antibody treatment Reconora has received an emergency use authorization in Brazil. And following its conditional approval earlier in the year in February here in Korea, it also became Indonesia became the first country overseas to give the green light last month. Now, meanwhile, the company also plans to gain approval from the US FDA as well as the European Medicines Agency. Meanwhile, the World Health Organization will lead trials for 3 potential COVID-19 treatment drugs, which will involve more than 600 hospitals in 52 countries. Here's more.
Today, we're pleased to announce the next phase in the Solidarity trial, called Solidarity Plus. Solidarity Plus will test 3 drugs: artesunate, a treatment for severe malaria; imatinib, a drug for certain cancers; and infliximab, a treatment for immune system disorders such as Crohn's disease.
Finally, let's take a quick look at some numbers abroad. The U.S. has hit 37 million cases in total, and Mexico has become the 15th country in the world to surpass the 3 million mark in total cases. And the global figure now stands at 205.5 million cases with over 736,000 new infections. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Meanwhile, authorities believe our fight against the pandemic has entered a grim phase, with daily infection numbers defying current social restrictions, which stand at their highest level here in the Greater Seoul area. For more, I have our Lee Kyung-eun in the studio with me. Welcome, Kyung-eun.
Hi, Sunny.
Right, so I mentioned there's been a slight drop in our daily tally on this Thursday, but not enough to put concerns to rest, right?
That's right, and health authorities are not sure if we're now in the peak of the fourth wave or if worse is yet to come. And forecasting the outbreak has become even more difficult ever since the Delta variant has emerged here in the country. But the consensus among experts and government officials on how to fight the outbreak remains the same, and that is more vaccinations. For the month of August, the government is planning to hand out first doses to 7.5 million people, mainly those in their 50s. During the same span, 8 million residents aged 60 and above will receive their second jabs. Health experts remain confident in the effectiveness of the vaccines, even considering the rare cases of breakthrough infection.
Getting vaccinated doesn't fully protect you from being infected with the Delta variant. But if you receive 2 vaccine shots, you can be protected with prevention rates as high as 60 to 80%. That is why it is important to get vaccinated.
Booster shots are also being considered as an option to provide better protection against COVID-19 variants. Israel is already handing out third Pfizer doses to seniors over the age of 60, while countries like Germany, France, and the UK are planning to administer boosters starting in September.
Right. Meanwhile, back in the country, Kyeon, I understand one reality raising the risk of COVID-19 infection here is the greater movement of people amid the summer holiday.
That's right. An increase in travel across the country is leading to more person-to-person contact and the migration of the virus from one community to another. People's movement nationwide in the past week was 30% higher than in January, near the end of the country's third wave. This implies that people need to be traveling much less compared to now to bring our current fourth wave under control. Health authorities have also expressed concern over the upcoming National Liberation Day weekend, when more travel is expected, which could pose fresh challenges to containment efforts.
People are being infected at vacation destinations and carrying the virus back to their respective communities after they return home, leading to the secondary and tertiary infections there.
Because of the looming threat, the government has launched a nationwide campaign asking people not to travel and to stay home over the long weekend. Concerns remain, however, as these measures may have become less effective compared to before due to a growing sense of pandemic fatigue among the public.
Right, pandemic fatigue, which of course is understandable, but the sad reality is that these restrictions are not likely to be eased anytime soon, right?
That's right. Well, there are some positive signs, such as the fatality rate that's much lower than during the third wave. The average weekly death toll has been hovering around 20 in the recent weeks. That's a sharp fall compared to the third wave, when the figure was around 200 actually. This is largely attributed to the vaccinations for the country's most vulnerable residents over the age of 60s. But health authorities remain cautious about any easing because of the country's growing number of severe cases that could potentially overwhelm country's healthcare system.
따라서 방역 수위 조정은
The fatality rate is an important determinant of our social distancing levels, but our medical capacity should also be taken into consideration in doing so, like the number of serious cases and our overall state of healthcare readiness, among other factors.
In fact, due to the high number of severe cases, the Seoul Metropolitan Government said on Wednesday that the city could face a shortage of hospital beds if it continues to report daily cases around the 600 range. Right now, the occupancy rate of the hospital beds designated for COVID patients is at 76% in Seoul. In Singapore and the UK, their COVID-19 strategies have shifted toward preventing deaths and hospitalizations rather than the number of infections in general. In effect, they have decided to live with the virus, believing the COVID-19 may have become endemic. The Korean government on Thursday, however, ruled out the possibility of taking a similar approach. Rather, it will try to secure more hospital beds or making more efficient use of the currently available hospital beds.
I see. All right, Kyeon, as always, thank you very much for the coverage.
Thank you for having me.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Thursday.
I am the head of planning and coordination, and let us now begin a regular briefing for August 12th. First of all, on the vaccine supply, tomorrow on the 13th, we have AstraZeneca vaccines, about 1 million more doses to be shipped from the Andong plant, and to this end, a total of 4 million AstraZeneca doses and a total of 11 million doses of the vaccines, which include these 4 million AstraZeneca vaccines, will be available here in South Korea starting from the month of August until now. And as for the details, we will be disclosing any further updates as long as we have further negotiations with the drug makers. And here are also updates on our vaccination booking rate for those aged between 18 and 49. And also, until 6 p.m. today, we are going to receive the booking for those whose birth dates end with 1. And starting from 8 p.m., we will be beginning the process for those who end with 2. And right now, we have a total of 2 million people, over 2 million people who have completed their vaccination reservation, which is about 56% booking rate. First of all, on the first day of the booking, we have also opened the booking for those whose birthdays end with 9, and nearly 840,000 people have completed their booking on that day, accounting for about 50% of the eligible recipients. And on the next day, we have had about 1 million additional people, which was about 61% booking rate. And we are also seeing that we are having a smooth reservation for this age group. And for more convenient use, we ask you to avoid the 8 p.m. mark and also utilize after hours to make your reservation bookings. And once again, we highlight the effectiveness and the importance of getting yourself vaccinated to protect yourself from the virus. Moreover, we have carried out the 7th round of the vaccination damage compensation screening meeting, and we have met during the latest meeting, and we have also looked at those compensation cases, and we have looked at over 700 cases that have been applied, and based on these medical reports as well as other symptoms, including the time of appearance of the symptoms after inoculation, we have concluded that after inoculation, people have experienced fever and allergic reactions, and also there were a total of 368 cases that have been subject to receive these compensation. And we also have one syndrome that has been reported. However, we believe that there was insufficient correlation with the vaccine. And out of a total of 21 million vaccinations, we have also had a total of 13 million cases that have been received as the reports as the adverse responses, and a total of 2,300 cases have been reviewed for detailed compensation, and about 50% of those have been subject to such compensation. And we continue to carry out and we continue to see that there were some cases as for those who have seen severe symptoms after inoculation, and those who have been were not able to prove the correlation with the vaccines, and we are having to provide them with a maximum of 10 million Korean won. And right now we have about 17 people who are subject to such emergency compensation, and about 4 people have received their compensation. And as for the rest, we would also give out the compensation as soon as possible. And here are some global updates of COVID-19. We are seeing a 7-week rise of the COVID-19 infections globally, and with the Delta variant in US, Israel, and Japan, we are seeing increase in the number of cases. For the past week, we have seen more than 4.7 million cases, which has been on an on-week rise, and the fatalities also increased by 2,000. And by region, we see Americas and West Pacifics, and also Europe. We have seen increased cases as well, and we also see fatalities increasing in the Pacific as well as Europe and Middle East. And as for the U.S., which has a very high rate of vaccination rate, we have seen the peak of the hospitalizations and also infections that has peaked for the first time since 6 months. And also in this country, we are seeing the infections among children, especially those who have not been vaccinated. And also last week, for the past week, we have also seen many infections. And also we are also in Israel, they are also carrying out the booster shots for those seniors aged over the age of 60. And as for Japan, they are also seeing a record high number of infections, and they are also seeing the highest tally after the Olympics, and they are also seeing a daily tally of over 10,000. And as for the average cases out of every 100,000 here in the country, the cases stand at about 22, which is relatively lower than many countries like the UK, US, and Japan. And also, we have fatalities about 0.09 and also 0.01 for every 100,000. However, here in South Korea, we have also relatively lower rate as well. And compared to these major countries which have high vaccination rates, here in South Korea, our vaccination rate is not that high. However, we were able to contain the infection size thanks to the public's efforts and also cooperation. And going forward, we will also continue to contain the virus with antivirus measures as well as vaccinations. And we also have some details, a summary of some infectious diseases that have been emerging in the year of 2020. And aside from COVID-19, we have seen a major decline in the number of infectious diseases, and out of every 100,000 people, we have seen about 28, which has been about 8.4% decline from the previous week. And we believe that there has been about 300 cases out of every 100,000 last year. And aside from COVID-19, we have also seen, as for the COVID-19 virus, we also, aside from the COVID-19, that is, we also see that the infection diseases have also declined, and we believe that due to the COVID-19 pandemic, people refrained from meeting together, and there has been a decline in the international travel as well as a decline in person-to-person contacts, which has led to a less spread of the other infectious diseases here in the country. And going forward here in South Korea, health authorities are continuing our monitoring efforts to contain the spread of any other infectious diseases. And we will also contain the spread of COVID-19 here in the country. And we will make sure to return to pre-pandemic levels and to enable safe environment for our citizens. Please wear your face mask and wash your hands at regular basis. And we believe that these are also very important in preventing other infectious diseases aside from COVID-19. We ask for your continued participation. During this weekend, we have the National Liberation Day coming up, and moreover, we are also nearing the beginning of the new school year. We believe that you should be also very excited about the holiday. However, we ask you to refrain from going on travel, and if we do not stop ourselves, the spread of COVID-19 would not stop itself. So during this weekend, we ask you to refrain from travel, rather stay home safe and sound. Moreover, at the end of August, we are also scheduled to have our students return to offline classes. And during the past year or so, many students had to stay at home and to have remote learning instead of going to school and hanging out with friends physically. So in order to ensure a safe environment for our youth, we need to also exert our full efforts. So for the safety of our children, please stay home during this weekend. And during your summer holidays, if you have visited other regions, please get the COVID-19 testings and also take part in the vaccination booking process that is carrying out right now. We believe that vaccination is the most efficient and effective way to prevent COVID-19 spread. And please take part in the vaccination rollout program. And the government will also make sure to overcome and contain the fourth wave as soon as possible. We will exert our full efforts to this end. Thank you very much.
Right, that was Peggyong Tech with Thursday's afternoon briefing. And as promised earlier, I have Kwon Soa back at the desk with a summary of his address. Right, Soa?
Right, Sunny. Let's begin with vaccination updates and with the supply of vaccines. According to the official, more than 1 million doses of AstraZeneca vaccine are to be distributed to vaccine facilities across the nation tomorrow from the production lines in Andong. So with that, we will have around 10 million of AstraZeneca doses that have been rolled out from August 1st until August 13th. And he also reminded that people with their last birthday digits being 1, those aged between 18 and 49, their vaccination reservation will end at 6 p.m. this Thursday. And with those with the last digit 2, they can make their reservations beginning at 8 p.m. until 6 p.m. Friday. He also reminded that it's going to be a faster process if they make that reservation past 8:30 p.m. He also said there's been some positive news regarding other infectious diseases apart from COVID-19 because there has been a decrease in other diseases in the past year, and that is likely attributed to people washing their hands more frequently and taking more care of their hygienes. Last but not least, he reminded that we've got a Liberation Day holiday coming up this weekend until Monday, so asking for the nation's people to try not to travel around, and also saying that the second semester for students will kick off soon as well. So we should keep continuing to abide by social distancing.
Of course. All right, so as always, thank you very much for that.
전국 환자가 2,000명을 넘은 것은 작년 1월 20일 첫 환자가 발생한 이후 처음 있는 일입니다. 휴가철 이동의 결과로 감염이 확산되고 전파 속도가 빠른 델타 바이러스의 특성으로 인해 전국적으로 환자가 증가하는 것으로 판단됩니다.
Shortages in COVID-19 vaccine supplies, the growing presence of coronavirus variants and cluster cases of breakthrough infections continue to challenge containment efforts here and elsewhere. For more on this reality, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
And I also have Dr. David Kwak from Soonchang University Hospital. Good to see you again, Dr. Kwak.
Thanks for having me.
Meanwhile, joining this session virtually is Dr. Gautam Kalyatanda at the University of Florida. Pleasure to have you with us, Dr. Kalyatanda.
Thank you so much for having me.
Right, we'll start here in the studio then. Dr. Kwak, there's been a slight drop in our daily tally today, standing at 1,987. It's still very close to the 2,000 level. Do you foresee a further surge in cases amid the presence of the Delta variant here?
Well, I dearly hope not. Even though we saw the little drop from yesterday, I can't really say that I'm going to call it a drop because we're still fluctuating up and above 2,000, and 2,000 clearly marks a very significant number for us because we've never had it before. It's like a mountain fire seeding spreading to other places currently. We're hoping to see a plateau of mitigation in metropolitan area, but unfortunately that spread to non-metropolitan areas. So the cluster infections and large numbers of infections are currently happening from non-metropolitan area as well. What's more worrisome though is that currently the numbers that are happening is rather dispersed. It's not from one main cluster infection or a couple of others. It's really coming from daily lives, daily activities, and daily family gatherings. So we really need to watch out for ourselves in regards to coming into contact with other people, not just in the matter of groupings, but rather than individual protection. So we need to give it some serious thought. But currently, I hope that it won't go further into having more surges, but rather hopefully it'll stay this way for just a little while, and then it'll go down to having a decline in the graph. But hopefully that'll happen soon as well.
Right, and we're sharing your hopes, of course. Dr. Kaya Tanda, I understand Florida has been breaking record after record with regard to daily COVID-19 infections this week in the wake of the Delta variant. Please tell us a bit about the situation there and elsewhere nationwide.
So it's been a rough few weeks here in Florida. We've had about 2.8 million cases, about close to 40,000 deaths. Our rates went from about 2,000 a day in June to about 20,000 now. Our case positivity rates have gone up from about 3.9% to about 19% last week. So, numbers have been increasing rather rapidly. The Florida Hospital Association announced that there were close to about 15,000 hospitalizations for COVID. About 33% of all of hospitalized had COVID. 47% of patients in the ICU had COVID. Our rates are probably the second highest in the US in terms of number of cases per 100,000 per day, close to about 90. Which is just less than Louisiana. So we would have been very happy with the numbers you have. So, it's extremely, and it's been a rapid rise, exponential rise. So a lot of stress on the health systems as well.
Right, of course. Now, Dr. Kim, as Dr. Kaya Tanda has mentioned, Florida is setting records for COVID-19 infections and hospitalizations amid the Delta variant. Speaking of which, we understand that the Delta variant is more infectious, but is it more lethal?
Well, we don't have the actually concrete data yet. I mean, some anecdotal data. We have actually some sort of just rumors and the anecdotes, just levels. There seems to be more some severity issues and probably some fatality issues. But so far, we don't have any concrete data yet. And then also about some other not just the past, but the sort of just earlier just a variant. One of the earlier concern was some beta variant that was actually identified originally from South Africa. But just recently there was a report coming out from some Middle East area about the severity and also case fatality rate of due to the beta variant issues. And then based on some very rigorous some clinical trial clinical data, there seems to be some effect it's not the beta variant seems to affect both the transmissibility and the severity and the case fatality issue. But luckily, the beta variant did not actually become the global predominant the variant yet. So anyway, just as conclusion, we need some data before to say whether Delta variant is causing any more severe diseases and also the death at the moment.
Right. Meanwhile, Dr. Kwak, aggravating our current concerns here is the recent detection of the Delta Plus variant in Korea, that is. Now, I'm aware information over this particular strain is still evolving, but what has been shared thus far about the Delta Plus variant?
Well, not much yet, but once again, as Dr. Kim mentioned, the Delta variant itself is not clearly causing more severity or more mortality. But on top of that, the Delta plus variant that we're trying to find out is only different from the Delta variant in one genomic sequence, and that's namely K417N. That's the location of the sequencing that differs from the Delta variant. But apparently that location was also mutated in Alpha variant and some other variants that we've seen before. So we are currently speculating, the scientific world are currently speculating that it won't necessarily cause more severe disease or even mortality. And also in regards to the transmissibility, they're not clearly seeing higher rise in Delta plus variant in those countries that were hit hard with Delta variants already, such as in India and some other countries. So we are currently thinking that it might not be so more transmissible or more severe in the variant itself. Number two, there was actually a case of our Korean national who was infected recently with Delta plus variant. And thankfully, he was priorly inoculated with two of AstraZeneca shots. And he's currently being said to be having very mild symptom and going through it very easily. So hopefully, the Delta plus variant, even if it was to come into our country, it won't be so effective in a sense that it won't cause more transmissibility or severe disease and mortality.
Right. Now, Dr. Kaya Tanda, authorities in the US are not only fighting the Delta family, so to speak, they're also tackling the Lambda variant, which was first reported in Peru late last year. What has been revealed about the Lambda variant thus far?
So I think we've seen about 1,000 cases of the Lambda variant. Again, the WHO kind of categorizes it as a variant of interest. The CDC still doesn't. I think I agree with the panel. The Delta variant is infectious and, it is so transmissible. I think the only thing that we're really fighting now is the Delta variant. The others, I think we will watch them, but I think they're nowhere close to gaining the importance from public health as much as the Delta variant is right now.
I see. Meanwhile, Dr. Kim, the Lambda variant itself has been detected in neighboring Japan. Now, health experts here say it's only a matter of time before it enters Korea. What are your thoughts on this?
Well, there have been many just variants so far, and then some variants actually became some predominant strain. For example, like in the earlier the pandemic, the D614G, that has to actually just become actually predominant just a variant. But now the Delta seems to just replace those variants as a predominant one. So the reason for that predominant of certain just the variant is that they somehow outcompete the variants. Because in terms of virus, actually just compete with each other in terms of replication and then in the certain just host environment. So I think the Delta at the moment, it seems to have some advantage, some relative advantage over some other just variants at the moment. So since you're just talking about Lambda variant, we do not know for sure. I mean, we actually talked about some Beta variant and even just the Gamma variant. But there's some areas, the Delta variant or certain the variants actually do not make a big, just a problem as compared to just Korea and the US and other countries. For example, like South America, some areas actually still just seems to be just the predominant. The predominant just variant seems to be still just the Gamma variant. And also some other areas is a Beta variant. So the Lambda variant somehow should just, whether before just becoming a predominant just variant, they should outcompete some other variants. So we have to actually consider such things. And then that's the case for the virus perspective for our public health initiative, where we have to do some keep monitoring any just occurrence of the variants, and also just maybe just earlier just a diagnosis for especially the people coming from outside, and also the contact tracing is very important.
Right. Dr. Kim, you've said this on our show before. Viruses mutate. It's a part of their life cycle. But based on the current global circumstances, are there any variables perhaps that may be feeding their mutation?
Well, that's right. Actually, virus just evolve. Depending on their environment. The earlier just the evolution is pretty much just affected by the the differences of the host. Whatever the immediate just host is, well, it's some people say pangolin and then maybe some bats, but the virus that sort of just fit in their original or intermediate host now just moves to the new host, which is a human being. So in different the environment, they actually just adapt themselves by evolving. But this is not just they do not have any intention. Just evolving is their just a natural way of surviving because of the some very lack of just proofreading capacity of their just some polymerizing enzyme activity. But then the for the now I think the adaptation in the human being is now pretty just well progress. But now the second just challenge in terms of the virus perspective is that there's some selective pressure. The selective pressure, in this case, we can think about like just some waning just the immunity and also some drugs. But for drug part, we do not have any just drug options as yet, as of now. The only just monoclonal antibody is the only option. And then for the vaccines or sometimes some just immunity just conferred by vaccination or some natural infection could just affect the some evolution of the viruses. If our just immunity is very just weak, then virus somehow just try to find a way to escape such immunity. So unless we just put the very strong pressure, for example, like by just some drugs or like a vaccine, then the virus always try to find a way to just evade such selective pressures.
Right. Moving on then, Dr. Kwak, authorities have decided to extend the dosing interval between the first and second doses of the mRNA vaccines to 6 weeks. Now, this comes amid supply issues with Moderna. What are your thoughts on this extension?
Well, I'm a little bit saddened by the fact that we were cut half of the dosage stocks that we were originally promised. But yeah, I don't think it's going to really make a huge difference changing the interval from 3 weeks or 4 weeks to 6 weeks. Because if I may give examples, different countries currently provide different times of interval maximally for these Moderna type mRNA type vaccines. For instance, if my memory is not incorrect, Canada claims that Moderna can be given up to 12 weeks apart. And we're only giving it at 6 weeks. And also through their third clinical trials, they have given this vaccines to people in different intervals, 3 weeks, 4 weeks, 5 weeks, and 6 weeks. So even though there is no accumulation of data in regards to the amount of antibodies each different intervals will create, I think 6 weeks of intervals will still provide us enough antibodies for the bodies to protect them from getting invaded by the virus. So I don't think having it go from 3-4 weeks to 6 weeks is a worrisome tactic right now. But we still need to get this dosage and stocks available so that we can finalize inoculation to the people who's already received Moderna shots as their first shots.
Right. And staying with mRNA vaccines, Dr. Kaya Tanda, recent studies in the US claim Moderna vaccines offer more protection against the Delta variant than do Pfizer vaccines. Do tell us more about this and do share with us your personal thoughts on these findings, that is.
Right, and I think this comes from a recent study from Mayo where they looked at the immunity over a period of time between them being vaccinated in January and then 6 months later, and they did see a waning of immunity over that period of time. It did go down, I forget the numbers, but it's in about 80s to higher 70% with the Pfizer vaccine. Again, we go back to the study in Israel where they spoke about decreased efficacy at about 6 months, which is about 63%. So I think, again, the first study from Mayo is in preprint, so it needs to be looked in more detail before we come up with any conclusions. But there have been other studies from Canada, Scotland, and Great Britain where they've looked at efficacies and it's been a little higher. So I think the main point here is that we get vaccinated. Regardless of what vaccine we use, whether it's Pfizer, Moderna, they definitely decrease death, serious illness, and hospitalization. In all these studies, they did that. So I think rather than being choosy about one mRNA vaccine versus the other, I think that the critical point here is that we get vaccinated, and that that saves lives. That stops the viruses from getting patients. And so I think if we are to fight this pandemic, we've got to do it through vaccines. And so really not so much about which vaccine.
Right. And staying in the US, Dr. Kalyatanda, according to media reports that the Food and Drug Administration is supposed to make public its green light for booster shots for those who are immunocompromised within this week. How do you respond?
Right. And again, we've seen this happening. We know that patients who have a compromised immune system are more likely, in spite of the vaccinations, to be hospitalized for COVID. We know that a booster dose increases the efficacy by sometimes 5 to 11%. So I think what the FDA is very clear is we need to give these booster doses to a subset of the population, and those patients are usually the immunocompromised patients. So it could be patients who have had solid organ transplants, but it could also be patients who have malignancies or cancers and are on chemotherapy. So it's going to be a subset of the population where they will give boosters. We don't have, it's not been reported as yet. I think the CDC meets on Friday, and they probably more than likely will give the green signal for that. But I think it's an important step because I think they are an extremely vulnerable group. We know that, and I think we should make all efforts to protect them in spite of the vaccination. And again, I think I heard that earlier as well, but Israel's been doing that. They've been giving booster doses to patients above 60 years. So again, I think there's a lot of data, a lot of studies that are going on to see in the different subsets of other populations when, where, and how the efficacy changes and when those booster doses should be given.
Right. Back here on the local front, Dr. Kim, Korea's SK Bioscience is embarking on phase 3 study of its COVID-19 vaccine candidate. Can you tell us more about this, please?
Well, this study is being conducted by the sort of just comparative clinical trials. Yeah, which is a little bit different for compared to some other prior clinical trials. In other preclinical trials, or like Pfizer and the Moderna case, we see the now just more than tens of thousands of people are participated for this vaccine trial. But this is not really practical at this moment because many people are actually being just vaccinated. And then so the alternative way, our government and also experts actually trying to find some alternative way, which is actually use some sort of just immunological correlative protection. So the usually upon vaccination, the vaccinees actually show some elevated levels of neutralizing antibodies and sometimes some T-cell response, things like that. So in this case, SK Bioscience using this kind of alternative method. So just compared to the some other prior just approved vaccine, in this case AstraZeneca is just the vaccine. So this is going to take take place with some several thousands of people, which is much just reduced the scale compared to some other prior clinical trials. And then I think this will just happen in Korea and also some foreign countries. And if this going as just planned right now, then it has some chance of just being just approved probably next year.
Right. Also here in the country, Dr. Kwok, in response to breakthrough infections at local nursing homes, authorities have decided to impose tougher restrictions there, including a ban on visits under level 4. What are your thoughts?
Well, obviously, the increasing the barrier and blocking physical contacts would reduce contact numbers and obviously reduce chances for the virus to spread. But in regards to implementation of such regulation throughout the nation, I think we need to think about the reality, how much we can do to pinpoint certain groups or certain hours to block physical contacts. Rather, I think it may be more effective to just completely block everybody for a very short amount of time and then open back up again. I'm not saying we should completely shut down the nation for several days. I'm just saying that maybe pulsation of such social restrictions rather rather than subgrouping and only blocking those groups to be coming into contact, I think may be more efficacious. So we need to give it some serious thought and maybe come up with better alternative ways to keeping the social distancing guidelines.
Right. And staying with measures to contain the pandemic, Dr. Kaya Tanda, what are your personal thoughts on the debate over face masks?
Right. There's enough data to suggest that masks work. There's lots of studies being done. They've been done across many countries for a long time to very clearly know that masks help prevent infections. And the Delta variant kind of is one of the most infectious viruses we've seen. It's twice as infectious as the original variant. So, if you're in a household, if you're in a closed surrounding, more than likely without a mask and with someone else who's positive, you are going to get the virus. There's no doubt about it. It has some of the highest rates of virus that you can find in the nasopharynx. It's just extremely infectious. And so I think with that data and also what we saw in India, because we were looking at patients in India early on during the pandemic, and it seemed that if you were in a house with someone who was infected, more than likely everyone in the house got infected. And those probably, kind of reflect in the kind of numbers that you saw in India as well. So with all of that being said, I think the CDC's guidance to mask everyone in school, and especially to protect children who are still not vaccinated, I think that's where the guidance came from, to mask everyone, whether they were vaccinated or unvaccinated, indoors in the school from K to K-12. So I think that's where they came from, and I completely agree with that.
Right. All right, Dr. Kaya Tanda over in the US, thank you very much for being with us at this very early hour at your end. Dr. Kim, you're in the studio. Thank you for your insights. And Dr. Kwok, thank you for being with us today.
Thank you.
Right, now that brings us to the end of this edition of COVID-19. Now we'll be back with more related coverage on Friday. Join us then. Thank you for watching.